Welcome to the season premiere of Conversations of the Heart, Season 6. Of course, it is always your boy T Till. We have a very, very special guest in the building. Um, she has been on this show a few times, and we ended season 5 with her. So this is the part 2 to our discussion about health and wellness. We have Dr. Gabrielle Williams of Gateway Direct Health. She is amazing. She's doing big things in the ATL, changing lives, creating incredible ways for people to have access to medicine, doctors, and transforming uh, the way that we see medical practice. And definitely want to say appreciate you for having this part 2 of our discussion here. We're going to dive a little deeper into a few things, but for the people who don't know, and it's probably not a lot of people who don't, please tell the people a little bit about you and your practice.
Yes, of course. Thank you always for letting me be a guest. We always have a good time talking, and I really appreciate you for being persistent and consistent with your podcast. We really appreciate you for providing good content. I am a family medicine doctor. I've been a wife. This year will be 12 years. I have a
Woo-hoo.
7-year-old and a 5-year-old, and we out here having our own practice too. So it's lots about trying to make some goals, trying to, make life the way that I want. So very
Mm-hmm. Wonderful. And, we talked in our last discussion about the direct primary care method. So I want to dive into this. As a doctor, and you mentioned wife for 12 years, which is an amazing Black love holler. Um, like you mentioned a 7 to 12-year-old, right? So what are you teaching them about medicine, doctors, from when we grew up? I mean, you are a doctor, so I assume the lessons are a little different, but how are you shaping the way that they view medicine and doctors?
Oh, that's a great question. I don't know if I I will because they don't I guess yeah because they don't really interact I will say yeah I will say they know like if they're getting sick that they need to go to the doctor for treatment. They know the importance of having a conversation, so I'll let them talk to the doctor. I don't know if the doctor appreciates that, but I let them talk to the doctor to speak up and tell them what's going on. Um,
Mm-hmm.
I think they see more of the entrepreneurship side, like going to meetings, meeting people,
Uh,
making sure to talk about the business. My 7-year-old is like, "Mommy, give me some business cards. I'll give it to people." So yeah, so more of the entrepreneurship side than the medical side.
mm-hmm.
Um, they know that, if I know my 5-year-old has asthma, so if he has a cough, he knows it's time to get his inhaler,
Mm,
based on like the things that they're dealing with. Shoot, if they get a cold, they know to get vitamin C. So they'll ask us for vitamin C. So I guess, yeah. So I guess we are teaching them a little bit.
mm-hmm. Now, this might be the most foolish question. Um, are you not their doctor, or is it or is it not a thing? Like, is it against practice or rules and regulations to treat your children or treat your family? Is it unethical,
So,
or like how does that work?
so let me tell myself. So,
Well,
ethically
don't
speaking,
don't
you
do
should
that.
no. I promise you, I don't mind. Ethically, they say not to treat your family members. So they do have a pediatrician that I'll send them to. Now, if you're talking, hey, if there's things at home that I can do, 1000% I'm doing it. Yeah,
Hmm.
I ain't going every time. If there, right, if there's, I have the knowledge, so I ain't going every time. But if there's something
Right.
that we need a prescription, I'll send them to the doctor. If they need to get for their annual checkups or vaccines, they'll go to their pediatrician. But again, if there's things that I can do
Mm.
at home, shoot, even for myself, things I can take care of, I'll take care of it.
Uh, that is that, and that's dope. Because I always say like, who's gonna care for your kids more than you, right? And when you're the mother and the doctor, right? That's pretty cool. Um, that's pretty dope. Um, and we'll talk about the husband real quick. So we're talking about also black men and just men in general in medicine, right? A lot of us historically, now me, I don't play by mine. I go to the doctor. But
Right,
I know
right.
historically, that's not what a lot of us do, right?
Hmm.
So how do you encourage your husband to keep up with his own health and wellness? That good, huh?
I can't tell on my best friend for telling you. You're gonna have to talk to him about it. Let's
We're
say I
gonna have
give
to
him
have him back on here so we can have this kind of
right.
conversation about health and wellness.
Absolutely know that I be nudging and I talk and I it's like, I'm a doctor, right? But now he goes and takes care of what he needs to get it taken care of. But for
Hmm.
sure I'm like pressing it. Um yeah, for sure I'm pressing it.
Good, good, good. Shout out to the hubs, Mr. Williams. So this right here, now we're taping this a day after inauguration, a day after things going on, right, in the world today, right?
Mhm.
So, yeah, I don't know if you know where I'm going, but I am going somewhere. So let's talk about high blood pressure and stress. Okay. So there might be a lot of people out there right now that stressed
Mhm.
to the nth degree.
Mhm.
And there's a certain demographic of people
Mhm.
or not.
Mhm.
They're happy, they're joyous, right? It's a great thing for them, right? But there's a lot of people that are honestly worried, stressed about what is these next few years are going to look like,
Right.
right?
Right.
Um, on top of their regular stress that they have, right?
Mhm.
So I want to talk a little bit about high blood pressure, right? Um, and there are some myths, there are some truths, there are some all of things in between, right?
Mhm.
About how do you get high blood pressure? Is it treatable? Um, right? Because there's a lot of things that can come from high blood pressure. So as the professional that you are, right? What do you feel, right? One is the best combatant for high blood pressure.
Oh, the best combatant for high blood
Mm-hmm.
pressure? Hmm. It's gonna be between cardio exercise
Mm,
and cardio exercise and then reducing salt intake and
mm.
fatty foods. Now, I know that stress management would probably be top. We don't work on that much, so I don't see the effects, the
A
benefits
lot of
yet.
us do not, right?
I would say that would be top stress management would, but I haven't, it's hard to implement lifestyle changes because these lifestyle habits have developed over years, but people are expecting if you eat a salad at the beginning of the year,
There's lots of
that
dressing.
should
Yeah.
keep you for the rest of the year.
Right.
So that's why I'm like, all right. Yeah, so if we're gonna go with what I've seen has been helpful, it's probably cardio, exercise, and food for
Hmm.
sure.
So let's start with, you know, kindergarten for those who don't know. What is even the baseline for good high blood pressure? Excuse me, for good blood pressure, rather. Like, what's the baseline where you could say, you know what, I have good blood pressure, and then what's the baseline for I have decent? It's not high,
Mhm,
but
mhm,
it's
mhm.
it's it's manageable, right? Because everybody has different. I feel like there's numbers
Yes,
that go all over the place, all right? So
yes.
so to get it out there, what is good blood pressure, and then what is like the medium?
Yes. So I'll even go further.
Yeah,
What is
please.
blood pressure? Because you hear about it, you check it, but you're like, what is it? It is the amount of pressure in your blood vessels. Who cares? Problem is, with high blood pressure, it causes micro tears in the blood vessels and can cause plaque buildup.
Mm,
It can stress the heart because if there's think about a hose and there's pressure. If there's water that's trying to move through, like the pressure or the
mm-hmm.
blockage in the heart, within the pipe, it has to exert much more pressure. So the heart has to exert so much more pressure to go against high blood pressure, right? And
Mm,
so then the heart can get enlarged and you get heart failure. Those micro tears happen in the brain. You get strokes. Micro tears happen in the kidney vessels. You get kidney failure.
mm,
So there's um, blood pressure matters because of that, because of the detrimental effects. Now,
mm,
a great blood pressure, 120 over 80s or less. 120 let me get some 110s, 116s, over 70s, 60s. Wonderful. Now, if we, I, people between
yes.
120 to 139,
Hmm.
it'll be like,
I
well,
feel like that's where a lot of people live.
130, 139. Yeah.
I feel like a lot of people live in the 130s. Could be wrong, but I feel like a lot of people live in the 130s, right? Where it's
Mhm.
like not enough to like panic, but it's not
Right.
great either,
Correct. Right.
right? Yeah. So okay, so 120
And
to
they've
139.
Yeah, they before it was like, you would start getting worried at 140s, but now 130s, we're starting to okay, like something to keep an eye on.
Mm-hmm.
140 over 90 and above, we're at high blood pressure territory for sure.
Mm-hmm. Is it
But
reversible?
absolutely,
Okay. Okay.
absolutely. Um, Now where what I find funny, forgive me guys, not funny, but just I don't know, it's a joke. People live in the 180s, 200s easy. And like, I'm good, doc. I don't feel anything. Here's a problem with blood pressure. It's considered the silent killer. So you might not feel anything drastic, right? But when people go from 200s, 180s down to normal blood pressure, they're looking around like, wow, I was living like that. It's like really subtle differences, dizziness, headaches, vision changes, just not feeling well, not feeling yourself, but
Hmm.
your body has gotten used to it that you feel like it's normal. But there
Mm.
are some subtle changes that you experience, but that's why it's considered a silent killer. I forget what was
Mm.
your question.
No. I think we go there because my mom always said stress is a silent killer, and then you just said high blood pressure is a silent killer. So, oh, it's like here, right? So, what does the impact have on the blood pressure, or how does stress impact your blood pressure?
Oh, yeah, that's a great question. So with stress, our adrenal glands make what we call catecholamines, which are like our sympathetic nervous system hormones, norepinephrine, epinephrine, some other stuff.
Hmm. Hmm.
Those start coming out with high stressful modes, right? Fight or flight or
Mm.
flee.
Hmm.
But the problem is they raise your blood pressure. They could chronically raise your blood pressure,
Wow.
chronically elevate your heart. And
Mm.
so that's how stress can impact your blood pressure. And that helps and that decreases the parasympathetic tone in the body, and that's the more relaxed tone.
Hmm.
Right? If you're at a more stressful state, the parasympathetic is not as strong. And so, yeah, we have an imbalance of the nervous system.
Man, I what I think about. I'm gonna be honest. I think as you're younger, you kids, you don't have high blood pressure, this, that, yeah, because you have no worries in life. Everything is just wonderful. It's just amazing. People are feeding you, they're buying everything for you. Everything is just great toys and playing. It's in high school, you got it's an amazing thing. Then you hit adulthood, um, and you hit the real world, right? I'm saying to myself, how does one really keep their blood pressure down when you have work? I mean, there are some people who are trying to earn higher degrees while they work. People are getting married, having kids. All are beautiful, beautiful. Um, but but can cause a lot of high level stress. People are especially in this economy, everything's
Mhm.
expensive, right? Um, trying to for an individual, it's expensive. Now imagine if you have a kids, wife, husband, family, all the things, right? It's pressure. It's a lot of pressure, right? Some people are getting laid off, right? And they have families. Um, these, people are, especially in, I think in my age group, I won't say your age group, I'll say mine, um, right? Where you are now having parents who have maybe passed on or now sick, right? And so you're dealing with kids or a sick parent or
Mhm.
both. It's high level stress, high level grief, high level this. There's so much going on. I'm like, is blood pressure inevitable? Like, I mean, and I mean that in an honest way
Yeah.
because there's just so much.
Yeah.
And people say, oh, well, eat organic. And I'm like, people are like, well, you got organic money? Like, people
Yeah.
are just trying to make it each and every day. And it's hard, right? No, not much money being counted. This, that, and the third. There are things that it just seems like it's just a lot of stress
Yeah.
that people are dealing with up here, right? That I feel like it goes on up here and it's in here, right? It's a lot going on. People are grieving. Like, I don't have kids, and this, I don't have kids yet. I'm not married yet. I'm not this yet. I should be here
Hmm.
by now. I should be
Hmm.
there by now, right? It's a lot of these things that's on people's hearts and minds and things that are going on. It's like the more you live, the more you grow, the more you get older. It seems like the more there's stuff. And it's like, it seems like if that was the one thing that's inevitable
Hmm. Hmm.
above all, it's like high blood pressure is like the thing. I could be wrong, but it just seems like everybody's going through a lot.
Yeah.
It's like, how do you combat that on such a large scale, right? In your own life. And it's like, yeah, cardio, cool.
Hmm.
Me, I say therapy, you know that, good,
Absolutely.
getting it out, right? But it's like, what else? It just seems like high blood pressure is such a major problem because as you said earlier, it could also lead to other things. Talking about strokes, you're talking a lot of just heart attack, you're talking different ailments, you're
Yeah.
talking about blood vessels in here, that could lead to some other problems and stuff
Yeah.
like that. So how do we, it's just how do you fight this? Right? Like as a person who loves wellness, like what are some of the things that you think that, of course, like you said, lifestyle changes are always hard because
Yeah.
things are rooted in us and stuff like that. But what if somebody can't afford to eat organic every day, right? And especially for a family of three or
Right.
four,
Right.
right? People with a family of one is going through like, man, listen, I gotta go to this ramen noodles over here. I gotta go
Oh,
get these pot pies. I gotta go get these Pop Tarts. You know what I'm saying? You're gonna have to make this thing work. You're gonna have to make this thing stretch,
yeah. But
right?
hello.
So it's just like when I think about it, it's a lot to think about to me. It's just because people are going through so much, right? Like, what are you seeing like with your patients, in general? Like, just what are
Mhm.
you seeing like that can be helpful?
I forgot to add weight loss. Now, if
Ooh,
you want to talk about
big
something to help
bags.
with the blood
Yeah.
pressure, weight loss.
Big bags, big bags. Yeah. Yeah. That's the food though, right?
Sorry, you guys heard it. I didn't say that. To
That was
make
all
sure it's
me.
clear because you're over there whispering.
That was me. Okay. But uh, but again,
Back
blood
to the,
pressure,
that's what you said.
stress,
Mhm.
weight, right? I'm a person. There's some people who stress and they lose weight. I wish it was me. No, no. When I say I wish it was me, it's almost
Talk
like,
about people
Lord,
who don't eat when
please.
they're stressed.
Like, I mean, that's almost like I want to go to church and just pray, like, Lord, okay, let me, if I stress, like, can I just be the one to just shed
Take away my appetite, please.
that? Because I'm a person, I comfort eat when I stress. And I'm like, oh God, and it's like all the things that like I shouldn't. I know that about myself.
Double stuffed Oreos got me. Not
I'm
regular
talking,
Oreo, double stuff.
I'm talking things I shouldn't be eating, right? Like I'm talking things I haven't eaten in like years. I'm like, oh, I want that. I'm like, why do I want that?
Why do I want? Yeah,
Like,
that's
why do I
good.
want this? But I want it. Why? right?
We have to start thinking about what we're thinking about.
It's a crazy thing, right? And so again, stress, people stress eat, high blood pressure, weight. It's like all in one, and people need to lose weight, right? So there's so many crash diets, there's so many diets, there's so many. It's another thing. There's so many programs. Man, even got them in church. Was it the Daniel fast?
Mhm.
People not even doing that for the right things. They doing that for the wrong things. I'm
Is that
going
going
this
on
Daniel
now? Is it a
fast.
month long or something?
Yeah, like I'm gonna go ahead and go on this Daniel fast. I need to lose about 50 pounds. I'm gonna go on this Daniel
Absolutely.
fast. You praying while you fasting? Nah, man, nah, dog. I'm just out here just fasting, bro. Like, like it's like everybody has a thing, a
Mm,
program,
yeah.
right? That you can go on, right? And it's confusing. Sometimes it's like, oh, well, this is this program over here. There's thousands of programs to help you lose weight and this and that. And then when you on that program, then what do? You find out that the stuff you was eating on that program is supposed to be healthy. No, it's not healthy. And now there's
Listen,
other things containing in there that can all can give you
listen.
cancer or give you blindness. And you sitting here like, what? I, I thought I was. It's so crazy. It's so crazy. It's so confusing. I think
Mhm.
for a lot of people. So it's like, I forget it. I'm about to roll up and just went to the house.
Listen.
Get this video.
Have
I'm gonna call
you
you.
heard of the carnivore diet? Just eating
I
meat and
heard that.
butter.
That sounds like death. Sounds like high cholesterol and death, right? But what if it works for somebody? You see what I'm saying?
Well, I think I think here's the thing. I think that some people, when they lose weight, they reverse
hmm
their diabetes, they reverse their blood pressure, all this stuff, right? But then
Yeah,
some people, it takes just something else, right? Like they could be losing weight, their blood pressure still got sky high. We have, smaller people who have really high blood pressure, right?
true.
So we really wish that there was like this just one thing, right? Because people could be high, stressful environment, but their blood pressure is fine. So as much as I wish there was this one thing that we could reverse and
hmm
take care of that, will take care of everyone's blood pressure. It ain't gonna happen. But the same way that diet is not a one size fits all,
hmm
like you said, like eating salad all kinds of different ways, and still, like they said, they eat one little carb and increase the weight. So I wish there was a way that there was one thing that people can do, well, that's why we talk about lifestyle change as a whole, and it's not
hmm
just okay, you exercise 5 days a week and you will drop the pounds. Yeah, well, maybe. And also maybe you might have to increase your exercise, right? Increase
hmm
the intensity. You're not gonna keep losing weight at just walking 30 minutes. You're gonna have to jog. You're gonna have to eventually. Um, so that's why it's important to target lifestyle changes in different ways. Some of us are still sleeping 4 hours at night.
mm
That ain't
Okay,
thinking
well,
about
I know you're looking at me because I know I told you before, okay, that that was a thing of mine.
not told you.
I like to report better. I'm doing better. I promise. Okay. I'm not saying I'm getting a full 8, but I am saying I'm getting more than 3 a night. I'm in between 6 and 7, I think, a night.
What?
No,
Getting
I
up
mean,
or going to sleep?
no, I'm saying no, I'm sleeping in between 6 to 7 hours a day
Oh,
now.
okay.
That's
Oh,
what
okay, okay,
before
okay.
it was like 3.
I wasn't even talking about you. It's hilarious. You see,
Well,
when the shoe fits, hello.
well, I mean, the shoe did fit at a point because I know I told you on one of our past shows that was one of my problems. I'm honest about mine, full accountability. But like I said, happy to report I'm anywhere between 6 to 7. Okay, anywhere between 6 to 7. So I look forward to the day I can, my girlfriend, hey, she gets like 8. I want to get that one day, um, but I haven't done it. I'm still a night owl at the end of the day. But and then they talk about water intake. So you're supposed to drink a certain level of water, right?
Mm,
Then people go out and buy. mounds of water, right? They got the jug, they got a bunch of different water bottles, and then the news says you shouldn't drink out of plastic bottles anymore. So you lost the weight, and I got cancer. Th- but this is what I'm saying.
Wow,
Everything
I
is,
lost the weight and I got cancer. That's funny. Wow, that's funny.
but this is what happens. It's like they go out and it's like, oh, water, 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 and we got to stop telling black folk that water and ginger ale cures everything because it doesn't. That's another conversation for another day. It's like I don't feel good, but I'm gonna go get some ginger ale and some water, and it's like that. I don't know if that's the elixir, but okay, cool. Um, but it's so confusing nowadays of what you cannot do, what you should do, what you should not do, right? And how you should do it, right? It's like
Mhm.
something causes something. Drink more water, then they never think about the bottle. Then they tell you to get glass bottles or glass things, and then that's super expensive for most people. For most people,
Mhm.
where it's like, how many glass water bottles am I supposed to like, or like, what am
You're
I
right.
like? All right, then they tell you, then you can't drink the tap. But then you know what I read the other day about tap water?
Mm.
It's good for your teeth apparently, because it has
Yeah, because that's fluoride.
fluoride in it. And if you drink water bottles out of the bottle, then
You
now
got
your
it.
teeth could be jacked up because they don't have the proper fluoride in it.
Yep.
What am I supposed to do?
Listen, move more, sleep more,
I,
stress less,
it
eat
is
less.
atrocious. I couldn't believe that if I don't drink tap water, then I stuff messes up my teeth,
Yeah.
and that can cause decay and this and that. Because now, but if I drink the tap water, I could turn into a ninja turtle. Okay, because of all the stuff that they have in the tap water, and I can get all kinds of diseases from all these things. But my teeth would be okay. So when you see me in a casket with nice pearly whites, just know the
We
tap
did the
water was
right thing.
amazing. It is and I think sometimes there's an exhaustion of I don't know what to eat. I don't know what to do. So you know what? I ain't do nothing.
Yeah.
Right? I think people there's exhaustion with just trying to figure out how do you stay healthy, right? Is it are things hereditary or are they not? Right? There's so many different things. Oh, well, high blood pressure runs in my family, so I have to go on high blood pressure medication. Is that true?
Hmm.
Not true.
Hmm.
Okay, right? Like it's so many different things. So how do you keep your patients sane, right? And second part of that, is there such thing as white coat syndrome that drives up your high blood pressure? I need to
Great
know.
question.
I
Great
want to know that
question. So
because for me, that's real.
you can
I
say,
be
"Oh, I
I,
got white
I be
coat."
going through it from doctor's office. I told my doctor be telling me off. Don't play, but
Right.
Miss Terrence, calm down, gotta
Correct.
relax.
Correct.
I'm
Actually,
like, look
how
at
do I
that.
help my people? I keep it simple. Like I don't have time for all, or I keep it simple, but also I'm like all the diets work, right? What are they doing? Reducing calorie intake, reducing carb intake, and working on portion control. So to me, if
Ooh,
we can look at those principles, if we can apply those principles, we're like, all right, that's what I can do for my own nutrition, right? And in addition to adding more fruits and vegetables, because we know that those have healing properties, you know that increased fiber helps control your blood sugar. Like we know in general, we
mm,
know those things, right? But that doesn't mean every vegetarian be eating well. But we know those things work. I also talk about exercise, and like I said earlier, how you eventually have to increase your intensity, your frequency. Like what worked for you to lose the first 10 pounds is not going to work for you to lose the next 10. And I think
mm,
people, it's hard to hear And that's where they hit the wall where I've been doing this, I've been doing that, and I lost it in the beginning, and it's just not working now. Yeah, well, again, what is going to take you to the next level, you're gonna is not what you did before. You're gonna have to up level your effort,
Mm,
and that's reality, and that's okay. So not just staying at one exercise intensity. I recommend therapy all the time because it's important. It's important to process these things. It's important to say, hey, it looks like this life is against me. I'm trying to do all the things. And
I
it just,
tell you.
these taxes keep coming up. The price of food keeps going up, price of gas. All right, everything is more expensive. I'm trying to get
Hmm.
an apartment, try to buy a home, but my measly money that I'm saving up for a down payment ain't doing nothing now, right? So it's important to talk with a therapist to remember gratitude, to
Hmm.
process, because a lot of the stress that impacts us is how we respond to stress.
Mm,
Are we
mm,
angry? Are we resentful?
mm,
Do we have fear? Like those will increase our sympathetic nervous system's impact, right? Those things are going to increase our cortisol. Those things are, continue to increase and can eventually impact our blood pressure. So yes, like I'm not minimizing all the stressors that we go through,
hmm,
we
hmm,
going through it, but how we respond is also as important, even more important.
mm,
Getting adequate sleep. And yeah, those are like very simple. It's not like again like a prescription where if you do this you'll be cured.
mm,
We have to try those things. We do have to try those healthy lifestyle habits and see
hmm,
what works. um Shoot, if you have sleep apnea, if you're out there snoring, you could be
mm,
on 3 4 medicines. Blood
mm,
pressure will still be high because sleep apnea is working against you. So there's even medical conditions that can cause you to still have what we call refractory high blood pressure. Like it's not none 3 4 medications are not helping to bring the blood pressure down to where it's supposed to be. Now, is there such thing as white coat hypertension? Of course, where people when they're in the office, it's really high. I don't know why people are nervous. Like doctors are just so nice and so like trustworthy, but they still get upset, they still get anxious when they come to see us. And when they're at home, it's normal. Now, I ain't diagnosing nobody with high white coat hypertension who don't check their blood pressure at home.
mm,
Check it at home
mm. Okay.
because it's probably just as high as it is in the office.
Oh,
Right? Like you have to check it at home. But no, I understand, like I don't minimize when they're in the office, people say when I go to the doctor, that's when I get bad news. There's one theory that it's because we actually checked what could be going wrong versus coming to the doctor actually caused it.
right.
Neither here nor there.
Mm-hmm.
But yeah, people do get anxious, feel like, okay, well, if I come to the doctor, that means that's it for me. Right? I've seen my family members, loved ones go to the doctor, go to the hospital, they don't come back, right? Or they're diagnosed with some terminal issue. So I get that. But check your blood pressure at home then. Check it
Mm.
in the morning when you first wake up, when you didn't cut someone out in traffic because you were waiting 30 minutes, though an hour when it's supposed to take you 5 minutes to get home.
No comment. No
So
comment.
check, so check your blood pressure at home in the morning.
True indeed. You know, in the good book, it says that God is not the author of confusion. If I'm not mistaken, right? I think it's somewhere in there. God is not the author of confusion. So I have a question. Why are there so many big back vegans? So I'm just because I'm gonna be honest with you, because I know sometimes where my big back comes from. I like food. I like meat sometimes. I like, things that may not be cheese and all the things that people should tell you that it's not good for you.
Mhm.
You get fat. I get it. So I know why. Sometimes it's like, okay, T, like you need to get back to the gym, you need to stop eating this, stop eating that. I need to go vegan. But then I see vegans. And this is where I'm like, I don't it's the God in me. But I'm like, I'm confused. And you're not the author of confusion. Lord, show me what's the thing here.
But God is not
So,
the author of confusion.
so, I'm. I'm no longer going to ask God about this. I'm going to ask you, the professional, about this.
Yeah.
Why
Hmm.
are there more heavier vegans, right? Like people who eat regular meat. Like
Hmm.
why? How is that even a thing when it's normally you're eating plant-based
Hmm.
everything,
Hmm.
no meat, heavy meat, no nothing.
Right.
Eating grass and plant-based stuff that you say is, like vegan steak,
Mhm.
vegan hamburgers.
Did you see the vegan oxtail? Apparently, that's getting people
That's
in.
disrespectful.
It's getting them in an uproar.
Never will I ever partake
Ah,
in
whatever.
vegan oxtail.
Anyway.
I've had a lot of vegan dishes in my.
Mm.
I've tried some things. Vegan steak. I've tried a lot of things. That would not be one of them. I even tried. I even turkey bacon. Yeah. So I just want to know how, and,
Mhm.
and, and this could be for the vegans out there too. How can you keep your weight down, or why does your weight go up as a vegan?
Go. I think I think of several things. One, when you think of the vegan foods, or the meats, they're pretty processed. Like there's not just plain, oh, I slapped on mushroom as my vegan like choice of meat. It's pretty processed with other things like to get it to the consistency and taste. And we know processed foods are not the best because it extracts a lot of nutrients. That's
Mm,
one. Two, portion control. Like that's also a thing. If you're eating too much of anything, that's a problem. And French fries are vegan.
really?
It's just fried potato.
Oh, that's I can see that.
So you can be vegan but still eat loading on carbs,
Hmm.
rice, on the potatoes, on the pasta. They're
So if I
they're,
just eat
they're
French
not
fries
based in
for a
meat.
day, I can say I'm vegan for a day. Oh, that's cool. Okay. I learned something new today,
You know,
and I didn't even know that.
what 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 did you learn new that something that can help you? I'm vegan.
I'm
Eat fries. Give me Chick-fil-A fries.
yeah, when you roll the drive, I want the vegan option. Give me French fries. I like that. I like that. Okay. So that kind of answers my question because I never understood when people told me that they were vegan, but they were big like regular people who eat meat, and I'm like, that's how. So what's the point of being
Yeah, I've seen
you?
portion control as a that's a big problem and
I
carb
guess.
increased carbs intake because carbs are vegan, right?
Hmm, okay. Okay. I get it. Okay. I appreciate that insight. Because I always wondered and struggled with that. I go, oh, what are you vegan? I'm like, ow, ow. You shouldn't be. You shouldn't look like, me in certain aspects. Like, oh, I'm saying, I know sometimes if my back get big, I'm like, okay, I need to drop some pounds. Okay, I understand. I say that about myself. I know it. I know it. But if you tell me vegan, you know, I'm expecting something a lot different. Lean and mean. Like I'm expecting ripped. I'm expecting, you know, I'm expecting just, hey, that's what I'm thinking. That's because in my mind, that's the results. It's like you
Mhm.
went vegan to do that, right? To be healthier, to be less, weigh an
Mhm.
appropriate weight, have your
Mhm.
BMI and be at a respectable, right, amount, right? And that's where I always just say, well, what's going on?
There's
Like
more. Yeah.
how is this a thing? But I appreciate that insight.
That's why I haven't said vegetarianism or veganism is the answer because, like you said, right,
Well,
since people are
vegetarianism,
still
I
not
feel
using
like
that
is
much.
was not the answer because you could eat seafood, and sometimes seafood is. I mean, some of it's good for you, but some of it you could do a lot of stuff with seafood that's not good for you. You know what I'm saying? So I'm like, you can gain weight being a vegetarian, but vegan, I'm like, you can't even. You gotta be eating grass, bro. Like you, you shouldn't be nowhere near a certain amount. But now I understand. But I didn't even really even think French fries were vegan. That's crazy. I get it now. Totally get it. So I want I feel like a lot of people don't know about this, and they might now,
Mm,
but I know you know about it. Insulin resistance, right,
mm,
is the precursor to pre-diabetes.
mm, mm,
So
mm,
it's not even pre-diabetes. So if you can catch it, you can catch the insulin resistance at a certain number
mm,
before he even gets to pre-diabetes.
mm.
I feel like a lot of people can be spared from diabetes, possibly, right? I know not all are the same, right? These are my views, not docs.
Yeah.
So can you explain how insulin resistance works, right? And why it's important to get that checked at your annual doctor visits?
So insulin resistance is a, I don't know, it's a common problem that is silent. Like, you won't know unless you like see the signs. You're like, okay, I'm gaining weight. That's, in my midsection
Okay.
and stuff like
Yeah.
that. But
Mm-hmm.
basically, insulin's main job is to move sugar from the blood into the cells.
Mm-hmm.
That's his main job.
Mm-hmm.
Problem is, and when there is too much sugar in the
Mm-hmm.
blood, it can cause insulin not to work properly. And so then it has a hard time moving it into the cells. It has a hard time giving it to the muscles that can process it better and use it as true energy versus just increase and making it into fat cells. And so, and when we have higher levels of sugar in the blood, we can start getting pre-diabetes and diabetes. And we know that sh high sugar is absolutely toxic. Like not the fake toxic, what we just call people toxic everywhere. This is
Mm-hmm.
toxic, toxic. Because you
Mm-hmm.
talk, I think diabetes is like one of the worst diseases because it's common. It can tend to run in families, because, genetic or environmental. Sometimes it's silent. If it's really bad, it's not. It'll take you to the hospital.
Yeah.
And it's just so common so that people are like, oh, it's just diabetes. But talk about stroke, like head to toe. You talk about stroke, vision changes, hair loss. You have heart disease. It can cause gastroparesis where your stomach is paralyzed
Hair loss
because
too?
it attacks your nerves. Glucose
Wow.
attacks your nerves. And so your nerves don't work well. Same thing with the feet. That's why people have amputations. It
Yes.
impairs wound healing, it affects your skin. It
Mm.
can cause number one or top two causes of people being on dialysis, having kidney
Mm.
failure.
Mm.
Um, and then it causes blockage in the heart, a blockage in the vessel, so that's heart attack, stroke. But also you can have that same issue in the genital area for my men, erectile dysfunction. Okay, not don't just go run for a pill. Figure out if you got diabetes, and
Stay away
then
from the gas
and then
station,
your
fellas. Please. Please.
and then your legs. So it's a I think I say it's like it's what we call glucotoxicity. Like all that glucose, all that sugar is just toxic everywhere.
Wow.
So insulin resistance is what we can catch before going to full blown diabetes. Is it reversible? Yes. Is it associated with other diseases? Yes. PCOS, those with polycystic ovarian syndrome tend to have insulin resistance. Again, weight gain, obesity, high blood pressure. I mean, we can
Mm-hmm.
kind of see a common theme here.
Mm.
And so very, 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 very important to get your annual labs. Like go ahead and just check it. It's okay. It's okay. At least it's better to know like any kind of issue, it's early intervention will always beat trying to fix the problem when it's already there. If you
But
can catch it early.
but to be honest with you,
Mm,
nobody tests for that unless you request it.
mm,
Right. I think and because I didn't know anything about insulin resistance until I saw my direct primary care physician,
mhm,
right? Um, because like you practices in the preventative stuff, right? Every time I went to the doctor, your A1C is good, your A1C is good, your A1C is good.
mhm,
Bye.
mhm,
And so it's like, oh, what? Yeah, wonderful. until like, one day my dad was like, your A1C is great. Insulin resistance, it's a problem. I said,
Yeah.
what are you talking about? Insulin resistance, like what? I was like, what is that?
Yeah.
And then when she broke it down to me and gave me the education, I was like, uh, but also the whole thing of, well, Terrence, don't panic, relax yourself. You're catching it in a place where we could reverse this thing. It
Yes.
might take some time,
Yeah.
but we can work on it, right? And I was like, oh, right. And when she told me about just how it works, and you know, it's the precursor to the precursor. So you're catching it even before, because
Or
even
yeah.
even if you get to the pre-diabetes stage, you can still reverse it.
Yep. Absolutely.
But this is a precursor to precursor. This is why we test for it. You know how many people don't know about insulin resistance? Like it's insane, right? Just how many people don't know that this is such an important test for you to run at your annual. But if you don't ask for it, you'll
Yeah.
never get it.
Correct. Right. So
Wow.
ask people, ask questions. It's okay to ask. People might be looking at you weird. Hey, hi, can I get that checked for my annual? I'm like, what? Yeah, just include that for me, please. Like, what's the point of saying no? There's none.
And that's why I think education is key because most
Mhm.
people, well, a lot of people don't even know to ask for it though. Because once I hear my A1C is good,
We're good.
straight, bro. Knowing you just came from McDonald's, but you straight, right? So, but this is what I'm saying though, right? Like
Mhm.
we don't know um what to ask sometimes or what extra test to ask for because that's not in any of and I go to the doctor before direct care. I went to that all the time. That was never part of the deal. I didn't even know what it was. And so I think that is kind of piggybacking off of our last conversation is the lack of information that you receive at regular doctors sometimes is a problem because you don't know to ask for that.
Right.
Now I'm sitting here telling all my friends, so get this test. Please get this test early. Knock it out. Right. If you go to a regular doctor, just please ask for this test
Right.
because man, like this could save a life. It could put somebody on the road to prevention really early in life, right? So, man, so I appreciate you breaking down what insulin resistance is and why we should get it on our annual visits. Is there anything else that you would recommend that doesn't happen at a regular doctor that you would encourage people to go out there and ask for and test?
Great. I would say actually not asking for something, but telling your doctor if you are snoring,
Mm,
your significant other has to sleep in the other room.
mm,
If they say, babe, you stop breathing in your sleep, I need you to, to get screened for sleep apnea.
mm-hmm,
Sleep apnea, sleep apnea, sleep apnea. Because I talked about it earlier, how it is linked to resistant or refractory high blood pressure.
mm,
It increases people's risk of diabetes, high blood pressure, um, and lung disease, right?
mm,
So it's not lung disease from smoking, right? It's a lung disease from not getting enough oxygen and not getting enough respiration into the lungs. Go ask your doctor, say, or tell your doctor, hey, my significant other says I snore or I get sleepy during the day when I should be awake. They say that I stop breathing in my sleep. I mean, even just hearing you stop breathing in your sleep should be an alarm to tell somebody.
mm. Well, I like that. 'Cause you're right about that. That's pretty scary. When you hear that, it's very, very scary.
Oh, they be going months, years. Like, yeah, they say I stop breathing in my sleep, and then I get up.
And I think there's some, what my doctor told me, in which I think that you can talk to a lot, is the honeymoon phase. And not, and people hear it in the relationship world, but more
Mhm.
so in the medical world, where
Mhm.
you know your insulin resistance it's high, but it's not, but you're not feeling anything. Like your blood pressure could be high, but you're not feeling anything. There
Right.
are things, and when my dad talked about, the honeymoon phase, it's like, yeah, if you let this insulin resistance keep going high, 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 at some point, the honeymoon phase that phase is going to be over,
Right.
right? And so just because you don't feel anything, or if you get high numbers and you're like, oh, but I feel fine, right?
Right.
Like,
Right.
how can that honeymoon phase destroy your life?
Mm. When, especially when, and that's the problem is like you could be in a honeymoon phase for a long time until 10 years later you go to the doctor and your A1C, you're supposed to be less than 6 and it's 11, right?
Mm,
It's 13. Your sugars are in the 400s and should be less than 100.
mm,
And so that's why prevention is key. That's why screening is key. Screening means we're looking for something that you don't know that you have.
mhm,
Yes, or because people say, "Hey, doctors just be looking for stuff." Yeah, you're right. Actually, you're partially right. I am looking for something because if we're looking for things that that there's so much benefit when you intervene, right? We're not looking for things once you have it, there's nothing that could be done. That's it. Okay, right. That's hard. But screening tests are important because we are looking for things that we can intervene on, especially early. Like why do we do mammograms? We're trying to find any breast cancer very early. Why do we do colonoscopies? Same thing, trying to find colon cancer early. Why do we check for PSAs, prostate tests, so we can catch prostate cancer early?
mm,
So please go to your doctor, even if you feel wonderful. I'm happy for you. I promise you, I'm happy for you. I love it for you. You should still get your numbers checked. You should still get seen to make sure that you're okay. You
mm,
should still get your mammogram, your pap smear. It's uncomfortable. I got you. One day they'll make it more comfortable. Until then, we will suffer. We're gonna suffer every 5 years or every 10 years when we got to do our colonoscopy and pap smear. It's okay. It's temporary suffering for potentially saving your life.
mm,
And not just saving your life in a way that you can live it and enjoy it.
mm. I love that. And you mentioned, you know, the, testing the mammograms for,
Mhm.
breast cancer and things like that. And, a lot of women or have cysts and certain things. And I mean, it's scary,
Mhm.
right? You just, because now you don't know what's what, and you got to get tested and all the things, right?
Yes.
And of course, go to your OB, let's get that out the way, of course, right? But from your, professional lens, right?
Mhm.
When it comes to that part, right, of women getting cysts and stuff like that, and can you speak to that a little bit in terms of is there prevention for that? Is there not prevention for that? Like sometimes I hear that it's not. It's just things that happen, especially with Black women having
Mhm.
density
Mhm.
issues and
Mhm.
things like that. Yeah, I know a little bit, but you know, uh,
If you don't mind.
but you know, but I think it's important that I know, right? So I can best have support, right,
Right.
in the ways that I can, right?
Right.
But how important, from your bird's eye view, of course, having a primary care physician and the OB, and
Mhm.
you know, the importance of maybe not panicking, maybe because so sometimes these cysts um they might they may not grow, they might shrink,
Yeah.
whatever the case is. Some
Yeah.
people are advised to get them removed, some are not,
Yeah.
right? But just talk to the ladies out there. The importance of getting screened. Um, and the cysts, that because it's scary. I have
Yeah.
friends that have a girlfriend. Just these tests are just scary, right?
Yeah.
And my mom was a survivor of breast cancer. And so um, I understand it. But if you can't speak to the importance of getting to those mammograms, those pap smears, and and if you do get a cyst, what next?
What next? Yeah. No. No. This is a great question because I Can only imagine when they say, "Oh, ma'am, we have to call you about your mammogram results." We all falling out. Okay? Like we're ready because we're thinking the worst.
Uh-huh.
But so then I'm speaking to my people who are like, well, again, the doctors are just trying to find something.
Uh-huh.
Well, guess what would be helpful when we're looking at cyst is to see what it was like the year before, several years before. This is why it's important not just for screenings to catch something, but it also provides a baseline so that we know what your breasts look like normally. So if there is something different, right, we can say, all right, so let's look at your past mammogram. Oh, it's always been there. Okay, less likely benign. It hasn't grown in size. It hasn't changed whatever calcifications are in there. That makes it more less risky. But if you have a cyst and you never had a mammogram, of course we're going to be highly concerned, right? And just a more red flag because we don't have anything to compare. So very important to get your mammogram. Again, get a baseline. Very important to do self breast exams. Know your breast,
Uh-huh.
sis, check those bad boys. So,
Uh-huh.
because again, you know your breast better than a doctor that's doing it once a year, doing a breast exam once a year. But when you do have a cyst, it's very like the radiologists, those who are reading the imaging, they're looking at different characteristics of the cyst. They're looking at the size, they're looking to see is it solid or is it just fluid in there? They
Uh-huh.
want to see if there's calcifications. They want to see if it's irregular borders. Like though there are multiple criteria that they're looking at to tell what the risk of breast cancer versus it being benign.
Uh-huh.
So, but they will call you back for potentially for doing an ultrasound, right? Because let's say look at the ultrasound, it looks at it better because a mammogram is essentially an X-ray. So ultrasound will give more depth and understand information. And then they'll decide, all right, does this need a biopsy? Do you need to see a breast surgeon to get a biopsy? Like what the next step is. But initially they'll do the x-ray and then do an ultrasound, a breast ultrasound for better characteristic of any abnormalities, and then decide, okay, do we need to see a breast surgeon, biopsy? Do we need to take things out? So on and so forth.
Uh-huh.
Um, Same thing for pap smear. It's very important to get pap smear and to get it done if you can by the same person so that everyone can know like what does the cervix look like? Has it always like when we document, okay, what does the cervix look like? Were there cysts in there? Was it this, that, whatever? So it's
Uh-huh.
very important for like to see the doctor to get documentation because I don't know of anyone who's looking at their cervix. I'm not, I think I think some people do. They get a speculum and they look at their cervix. Great, happy for you. But most people don't. So it's important to see a doctor for it. Um, Prevention of breast cancer. So I know a lady who wrote a book, or yeah, who wrote a book that said mammograms are not prevention, and she's right. Mammograms are screening tests. We're just looking for something if it's there, but it doesn't prevent you from getting breast cancer. What does? Weight loss,
Uh-huh.
eating well, exercise. Actually, studies that show that decreasing alcohol intake. We could talk about it. But I don't know if we're ready because it's going to be the same conversations that we had since the beginning of this podcast. I'm telling you, I'm realizing like people are looking for more and more. Oh, like, no offense to people. I'm sure you believe in this. Oh, it's the antioxidant diet. Oh, it's this diet. Well, guess what? It'd be the same things that we tell you guys to eat. Fruits and vegetables. Oh, this ginger has antioxidant properties. Yeah. We just don't say it as like as fancy and attractive, antioxidant and
Right.
all kinds of stuff.
Uh-huh.
Or this is the food that you should eat for your blood type. It'd be fruits and vegetables that they're talking about.
Uh-huh.
I'm just saying, like,
Uh-huh.
package it the way that people can digest it, fine. I'm with it.
Uh-huh.
But I hope
Uh-huh.
people are realizing that we're saying the same thing over and over for all the diseases.
Right. Right. And so switching gears a little bit, but not ovarian cancer. I, is there a thing? I know there's, screening for, of course, breast cancer and stuff like that. From what I understand, ovarian cancer is a little trickier, right? Not a lot of screening for that, if I'm not mistaken, right? Um, so is there any kind of test or full body scan that you might can do to detect
Mhm,
it?
mhm,
That may not be covered by insurance.
mhm,
Sometimes, but is there any kind of preventative things or things that you've heard of,
mhm.
or any best practices for women to combat this?
Yeah. So, ovarian cancer, pancreatic cancer, brain can like there's a lot of cancers that we don't necessarily screen for because there isn't a great screening test, unfortunately.
For brain cancer, yeah, I thought it was a MRI with
But
contrast.
there's no recommendation that everyone does an MRI and how often to do an MRI
Mm,
for brain cancer. Like
hmm
there's um so now the part of the reason is that if there is a some tests that have been presented for as a marker for those cancers can be positive for other reasons.
mm,
So with screening
mm,
tests, we need them to like if someone has a positive test, we need it to be likely that that person has this issue. We
mm.
don't want if someone has a positive test, there's a million other things that could make that thing positive. So then
Right.
what are we doing now? Everyone's getting unnecessary testing.
Mm,
Now, right? Because we're first like do no harm, right? Now there are full body scans, there are can't like tests that can't that there are tests that test for different types of cancer.
hmm
Um, and they're out there. And I know for some people that provides some relief and some reassurance. The thing that you just have to be careful for is if something does show up, how likely is it benign versus malignant?
mm,
What are you going to do about it?
hmm
Let's say you have something in your kidney. That means then if we're considering cancer, we have to do a biopsy of your kidney, which is not a benign test. That's going to take some,
Yeah.
it's a whole
Yeah.
procedure. So we just
Right.
have to think about, okay, if something is positive, what is the next step? Are
hmm
we doing routine MRIs every year for that thing? Again, that could likely be benign or it could be cancer. Either way, but there needs to be a plan in place for what you're going to do for what's positive. Same thing for like the blood test. If something is positive, it doesn't necessarily point you to which cancer it's going to be. So then what's the next step? Potentially do a full body scan.
hmm
Just know that if there's something that is found, what's the game plan to take care of it? How likely is it to be malignant or cancerous? What's the plan to take care of it or to monitor it? And that may take more testing than than you're used to. That could mean paying out of pocket and finding a low cost
hmm
MRI imaging facility or CT facility to
hmm
get those tests done. And then you have to think about how often to do it. And
Right.
part of the problem is that we have not been trained with those tests about how to do it and how frequently. So then you have to find a doctor who's willing to maybe do some digging or to
hmm
collaborate with a specialist to figure out, okay, so what are we going to do about it?
Mm. Gotcha. And we're gonna get you out of here in a few minutes, but I can't forget the fellas now. Can't forget the fellas. Um, for their uncomfortable test, like prostate, prostate exams, colonoscopies. You know, I know, especially in culture, getting those colon screen tests could be a little different. It be a little different. But how important is it for men to get screening for, prostate cancer and colon cancer? Because I could be wrong, and you tell me if I'm wrong, but colon cancer one of the most curable cancers out there?
Great question. How important is it? Get your life together and get your prostate test. Not you. I'm not talking to you.
Oh
I'm
yeah,
talking to you. Look. I'm not talking to you as I described you.
as you described, yeah.
I'm messing with you. I'm messing with you. If you have, no, I don't, again, I don't, I'm messing with Till. If you have a family history of prostate cancer, get your
Mm,
life together. If
Mm-hmm.
you are black, get it together. You
Mm-hmm.
know, like black races, you consider higher risk for prostate cancer. If you are in your 40s, get your life together. You're fine. Temporary discomfort.
Damn, I just turned 40. All right, thank you. But I've already got screened for colon cancer, so I mean colonoscopy and all that stuff. So yeah,
Yes, yes,
so
yes, yes.
hey, listen.
Now, for colon cancer, so it depends on what stage that it's caught, right? There's different tests that you can do for colon cancer screening. Colonoscopy is the gold standard. It's been out for so
Yeah,
long. You take a camera and you show the whole colon. They got a camera to look at the whole colon. This is
they
my
put you
way
to
of
sleep,
saying it
fellas. They
instead of
put you
what
to
they
sleep.
really.
I'm just telling you, they put you to sleep. You gotta relax. They put you to sleep. There's
Listen, in some
nothing
countries they do not. You wide
in this
awake.
country they do. Okay, so I'm just saying, fellas, don't be too shy. You know what I'm saying? It's just not that kind of thing. It's all right.
That's fine. And then there's also a stool test that checks for blood in
Yes.
the stool, and
Mm-hmm.
also another one that checks for DNA that's common with colon cancer.
Mm-hmm.
Then why I like the colonoscopy, although it's uncomfortable, because if you have a polyp or something abnormal, your doctor can see it and can take it
Take it out
out.
all at once.
Because if
Mm-hmm.
you're positive for the stool test or positive for the DNA test, guess what they're gonna have to do? Going up in there anyway. But I reserve that for my people who just will refuse to go to colonoscopy. Okay, fine. That's fine. We have other things that we can do. Should they even have a CT or is it MRI? I think it's a CT. Or yeah, I forget. Sigmoidoscopy. Anyway, one of the imaging to look at your colon too. For people you're not going to do it. Okay, we got a different way for you to do it. But if it's positive, you still gonna need a colonoscopy. So yeah, so back to the colonoscopy, if they see something abnormal, they can pop that thing out, right? Cut it out, and then
Test it.
they'll cut up in pieces,
Mm-hmm.
look under it with a microscope. Oh, that was cancer. Oh, that was stage one, right? Or they might then they'll make sure that there's good margins, make sure all the cancer was taken out, and then do a PET scan to see if cancer has spread anywhere else. You call
Mm-hmm.
it like, and then the hope is that it did not spread. There's no metastasis, and we got it early. So that's why I would highly recommend the colonoscopy. Your doctor can see it, can take out precancerous cells. Those
Mm-hmm.
exist as well. So get your life together.
Mm-hmm.
Just get it
And,
together.
and on the stool test,
Mhm.
sometimes it can come out positive for blood, but it could be a hemorrhoid. It could be a lot of different things that's
Again,
not that. But
again.
again, right? Because people see that and life changes. The thing gets you hot in the collar. If you get a positive test for, blood in your stool, that thing gets you hot in the collar. They call you for that, life changes. It feels like that, right? Um, but yes, these are the important reasons why, fellas, ladies, get tested. Screened.
Get it together. That's the end of the end of the podcast. Get it together.
Get your life
This is
together,
it's
please.
okay. Temporary discomfort with the hope of changing your life or keeping it great.
You know, and to be honest, the colonoscopy wasn't uncomfortable. Like, except for like the night before, like you gotta do the
It's a
thing.
prep.
But even then, it wasn't terrible,
Hmm.
right? Like the thing kind of tastes like, kind of tastes like a little grape juice, a little bit. You know what I mean? To give you flavors. It wasn't terrible. I thought it was going to be terrible. I had this thing. I was like, this thing about to be crazy. But if you can take shots in the club, you can take that. That's all I'm saying. Like, I know I'm just saying, if you can take shots of things that you like out there, that a lot of people do. People take all kinds of, and they do. Stop. You know that. I'm not telling you. No lie. People do things. It wasn't bad, right?
Don't let him thinking that it's just gonna be a shot. You gonna drink a jug.
It's a jug, but it don't taste as bad as what I'm trying to say. It don't taste as bad as what I thought it was going to taste like. You
People
know what
say
I'm
Dr.
saying?
Williams said it was just a shot. That's what it
Nah, I say if you can take a shot of something really nasty,
Right,
this
that's true.
isn't gonna
Alcohol.
be it's not gonna be terrible for you, is what I'm saying, right? And it could save your life, you know. And I think that's the most important thing. I think they've said like if you can catch colon cancer in early stages, like it's one of the most, you know, preventable things,
Yeah.
you know, and so gotta do what we can, you know, and so I just want to say thank you to Dr. Gabrielle Williams for um coming on the show and really all as always keeping it as real as you can and uh giving us the information and giving us the knowledge that we need to move further on in life and to be the best, healthiest version of ourselves that we could possibly be. Please tell the listeners how they can book you, how they can reach out to you, and and where you're located.
Now we're talking. So
Yeah,
yeah,
yeah, let's
I'll just
go. Yeah.
um I am in Stockbridge, Georgia, so South Atlanta.
Okay.
But we are definitely taking new members. We out here really trying to change people's lives for the better and in a way that like they know that they're along for the ride, not, oh, the doctor just tells me what to do and I just do it. Well, no, it's a conversation. We're gonna make sure we're all on the same page. So you can find me at gatewaydirecthealth.com
Hmm.
on all social media as Dr. Not Miss, so dr.notms. And yeah, you can DM me, comment on the videos or reels, all the things. But we are taking new members. So if you're wanting a different type of healthcare, the healthcare that T Tillis has, mhm, that he always
Yeah,
talks about,
it's
mhm,
nice. I'm
you
not
got
gonna
it,
lie.
Eileen.
It's nice on this side of life. I won't tell you that lie. Um, it is. I can't really see myself going back um to the other way, the regular way. Which, like I said, that's what you have. That's perfectly fine. I don't have.
Yes, absolutely.
But once I really got a taste of this life, yeah, I'm not going back. Different. It's a different type of care. And if you're
Yeah,
in the Atlanta area, please support Dr. Gabrielle Williams in her practice and get your life together, right? And she'll get yours together too. You know what I'm saying? It's a two-way street. She can only do as much as you want to do for yourself. You know what I'm
totally.
saying? So definitely check her out and let her know that T-Tail sent you. Yeah. So this has been another episode of Conversations of the Heart. As always, it is your boy T-Tail, Dr. Gabrielle Williams. Thank you. We will see you next time, and we hope you come back on our show. Peace.
Absolutely.